Please welcome back to the stage Dr. Alberto Caban Martinez.
So welcome back. I appreciate your time in taking a photograph to commemorate our 2024 International Firefighter Symposium. So now that we've had a chance to look at what is happening from an international perspective, we will pivot and come back to domestic. A topic that is important in the fire service is perfluoroalkylated substances, or forever chemicals. We'll begin this session with a scientific vantage point to understand a little bit more about what PFAS is. To do so, we've asked Dr. Miriam Calkins, a research industrial hygienist from the National Institute for Occupational Safety and Health, to provide us with that scientific overview. Dr. Calkins serves as the co-director for the Exposure Assessment Core of the Firefighter Cancer Cohort Study and the project officer for a feasibility study of PFAS exposure and health indicators in occupational settings. She completed her doctorate in occupational and environmental hygiene, as well as her master's in exposure science at the University of Washington in Seattle, UW. Currently, Dr. Calkins' research focuses on per and polyfluoroalkylated substances, that is a mouthful to say, comprehensive exposure assessment for firefighter during fire response, training and investigations, and occupational heat exposure. Please join me in giving a warm welcome to a kick-ass industrial hygienist from NIOSH, Dr. Miriam Calkins.
Thank you, Alberto, for the introduction. I appreciate it. And I'm very happy to be here today, although I apologize I can't be there in person. I know that there's a fantastic group in the room, and I'm very jealous of all of you who get to have some face time and have a wonderful couple of days in Florida. So I am very excited for this next segment. It's something that I spend a lot of time on, and I know it's a topic that is very near and dear to a lot of hearts in the room. And so I'm going to provide essentially the introduction to the per and polyfluoroalkyl substances, or PFAS. From here on out, it will just be PFAS. So the focus of my part of this segment is going to be on how we assess exposure and monitor these chemicals. And so I'm not going to focus on the health, just on the exposure side, since that's really my forte. And I'm also going to try to catch us up a little bit on time, since I know lunch is around the corner for everybody. So I may go through some slides a little quickly, but I'm happy to answer questions at the end. So before we can really talk about exposure, I do want to make sure we're all talking about the same thing. I know that this is a chemical group that a lot of people are familiar with, so I'm not going to belabor the background, but just to start us off, PFAS refers to a very large group of chemicals. Depending on the definition that you use, there's over 14,000 individual substances, although far fewer than that are actually used in commerce, and really only a very small fraction are those that we can actually measure, which we'll get into later. They are entirely synthetic, which means that they're not naturally occurring. We have to create them in a laboratory setting or in a manufacturing setting. And they primarily consist of a fluorinated aliphatic structure. Basically, that means that there is a chain of carbon molecules where all or some of the hydrogens have been replaced with fluorine molecules. So PFAS generally are grouped as per the picture that you can see on your screen. We have polymers and non-polymers. Polymers tend to be very large, and they tend to be a little more stable, or much more stable than some of the non-polymers, and include PFAS such as PTFE, also known as Teflon. Non-polymers are often used in the creation of polymers, or most often used in the creation of polymers, and can be further classified by the polyfluoro and the perfluoro substance. The main difference being that perfluorinated substances are those that are completely fluorinated, so all of the hydrogen molecules have been replaced. Polyfluorinated may just have a few. The polyfluorinated substances tend to be a little more volatile, and they also tend to be considered precursors for the perfluoro substances. So you'll see a lot of movement between these different groups from one to the other. The perfluoro substances are the ones that we talk about the most. They're the ones we have the best methods for. They're the ones that have been measured in a lot of things, so PFOA, PFOS, and so on. And they are sometimes referred to by their chain length, so C8 or C6, long chain, short chain, and so on. They'll also be referred to by their functional group, so sulfonates, carboxylates, and so on. So PFAS have been used very extensively. They've been integrated into products and processes since around the 1950s. And that's because they have a number of very desirable properties, including their ability to repel both water and oil, being very resistant to thermal stressors and pretty chemically stable. They're known for being very environmentally persistent, and there's a growing body of toxicological as well as epidemiological evidence that they can affect a number of different health systems. This includes, but is not limited to, reproductive, cardiovascular, endocrine, immune, and other systems, specific organs such as the kidney and the liver, and then also they can increase the risk of certain cancers. So there's been a lot of work to understand exposure in the general population, including in the United States, measuring a select number of PFAS in the National Health and Nutrition Examination Survey. This is measured in serum. It says blood, but typically it's been serum in this population, which is just a part of the blood. And we have observed that in this population, certain PFAS have been declining. And this really corresponds with the intentional removal of these certain PFAS from production in the United States. But it is important to note that we don't measure all PFAS compounds. We don't even measure all of the ones that we have the ability to measure for because of some of the properties of how they behave in the body and just the nature of this type of a surveillance project. There's also been a lot of work to understand environmental contamination, since for the most part, that's where a lot of that general population exposure comes from. So there's quite extensive contamination of our environment in the United States as well as internationally. And a lot of this occurs in drinking water. But there's also been a number of documented exposures that have resulted from contamination of food and wildlife, contamination of air, and so on. So in addition to understanding what types of sources, what types of locations there may be environmental contamination, there's also been a lot of work going into understanding how much contamination there is there. So one of the big surveys that you'll see and that you'll hear reference to understand this background contamination and water contamination is the UCMR3, which was completed about a decade ago, and the UCMR5, which is currently underway. UCMR standing for Unregulated Contaminant Monitoring Rule. Basically, it's just a big effort to measure things that are not currently regulated in our water system. And currently there's 29 PFAS that are being measured. So we're looking at, are they above or below certain thresholds? But from an occupational perspective, water is not typically what we would think of as being the primary source of exposure. And so there's been a lot of work to try to understand the life cycle of PFAS and where there's potential for exposure, but not really a lot that's actually gone into characterizing these occupational exposures. So generally speaking, we know that workers may be exposed throughout the life cycle of a chemical or a product. And this figure here, I will note, is for fluoropolymers specifically, but it certainly would apply to other types of PFAS or even other potential hazards. So there's potential exposure in the manufacturing process, the use of the product, the disposal of the product, and so on. And for PFAS, there's been an extensive application across different products. So there's a lot of different potential settings for this to occur. And that exposure may be very different from community exposures, not only in the sheer quantity of the PFAS that's present, but the concentration that it is in the media, the type of PFAS, so the moiety is the specific PFAS that's there, maybe a precursor instead of that terminal compound, and then the exposure route as well, how it gets into the body. And for firefighters in particular, the picture gets even more complicated because firefighters may be exposed and may come in contact with these chemicals in various different ways throughout all of those segments. So they aren't just working in manufacturing, or you aren't just using the product, but you're really potentially interacting throughout. So it can be a very complex way, or very complex exposure. So how do we assess exposure? Well, backing up to kind of exposure assessment 101, there's 4 basic categories or areas that we try to consider when approaching an exposure assessment. We want to understand the source. Where is it coming from? Is it industry? Is it contamination? Is it a product? We want to understand the pathway. So how is it getting from that source to the individual? Is it air, water, the product itself? We want to understand the route that it gets from that pathway into the body, so inhalation or dermal absorption. And then we want to understand how it moves about within the body. And this is a term that's usually referred to as toxicokinetics. You'll also hear absorption, distribution, metabolism, and excretion, also known as ADME, to really describe some of those factors that are critical for understanding how that compound moves throughout the body. Additionally, we'll include various exposure characteristics when we're considering how the chemical is moving through all these different levels, including the duration and the frequency of the exposure, various chemical properties, such as the pH, which can be really critical for understanding whether or not it's actually getting into the body or not. And then the presence of co-exposures that actually can facilitate or defer or deter the exposure from occurring. And then there's others as they come up. So there's kind of two ways that we can approach actual monitoring or assessments and measurement of an exposure. One is by looking at what's in the body, so what has gotten into that individual. And then the other is by looking at the environment around that individual, so both the work site as well as the general environment that they maybe work or live in. And there's pros and cons to both of these. So for looking at exposures or measuring exposures in an individual, we are looking at the cumulative exposure, so the exposure from all the potential routes. And this is really important when we are trying to compare that person's levels of exposure to their potential health outcomes that we're maybe looking at. It also gives us a very individual or personal level exposure measure, so we aren't trying to extrapolate from one group to another. And it does account for or integrate considerations for PPE or other exposure control measures. However, we are not able to identify the source of that exposure. So if we have a serum concentration for PFOA, we can't determine if that is from water or from a product that they're using or from another environment without pairing it with more information. On its own, it doesn't give us that detail, but it does tell us what that person has in their body. These collection methods can be kind of invasive. We're asking for blood that requires a needle stick. And then they're also very dependent on factors such as time and the half-life of the chemical. So you have to make sure that you're collecting that sample at a time that's appropriate so that it's actually has gotten distributed into the part of the body that you're measuring. And then also that it hasn't left the body already. So for exposures that are very short-lived in the body, getting that timing right is critical. On the flip side, in the work site or the environment, this is not a very invasive procedure. We can go into a work site and collect this data without having to interact with people and disrupt their workflow or their schedule. It is quite source specific, so we understand exactly what is in the medium that for the most part, we'll get into that later. But we understand what's in that medium that we're measuring, so what's in the air or what's in the dust at that station. And it can be generalizable. So we can take measurements at a number of different places and then figure out what is likely going to be occurring at other places that are similar. But it can also be individualized. So we can compare one person to another person by taking personal air sampling measures or by wipe samples in that person's work area. However, it does not fully account for the route of exposure. You can probably assume that if you're measuring it in air, inhalation is going to be a really critical route of exposure for that concentration. But it also could adhere to the skin or get in the body in other ways. It also does not integrate factors such as PPE or control measures that may be present. So looking at firefighter exposure and PFAS, we have a number of different sources and pathways that we're considering. And this is the not all-encompassing list, but it's I think a pretty good list, where we're looking at aqueous film-forming foam. That's kind of a traditional source of exposure that's really critical. Turnout gear is one that's definitely receiving a lot more attention and a lot more research to understand that contribution more recently. Emergency response, so just the type of environment you're going into, is one we don't understand terribly well when it comes to PFAS and what's released from a fire, for example. Dust in fire stations and vehicles is one that is also looked at more recently. And then also, while maybe not just an occupational component, looking at local contamination of food and water is really critical, since often people may be living or working in areas where there is contamination from use of firefighting foams and things like that. But even within each of these, we're still not taking them at face value and trying to tease apart all the different criteria. So to use turnout gear as an example, we have the gear itself, and we have the PFAS that may have been intentionally added into the textile or added onto the textile to enhance certain properties. Then we also have the fire response and the use of foam that may have provided additional sources of PFAS that can adhere to the gear, or that may change how the PFAS that was added are present. So it may release them, it may remove them, it may affect it in one way or another. So trying to understand exactly what's going on there is important when we're doing a really thorough exposure assessment and looking at sources. But how do we apply this? So when we are looking at PFAS, typically, most of the data has really focused on this biomonitoring aspect. And that's because most of the PFAS, and we'll get into this in a minute, have a pretty long half-life in the human body. And so the blood has been a pretty good matrix. So the serum has been a good matrix to measure PFAS in. But there's also a lot of work that's been looking at the environment. And this is really critical when we try to talk about intervention and exposure reduction strategies and understanding where it's coming from. Once we know that firefighters do have higher exposures or higher serum concentrations than comparative populations. So this work mostly looks at maybe air, dust, water. The methods are a little more limited in some of these areas, as well as bulk materials such as the foam itself or textiles. And then we put them into models and try to see how the two relate to one another. As we know, as I mentioned, PFAS are persistent in the environment. They stick around for a long time. And for the most part, some of them have relatively long half-lives in the body. Some PFAS have up to 8, maybe 10 years, depending on the study you're looking at. Others, though, are pretty short-lived. So they can be a few days to a few months, depending on the PFAS that you're looking at. And then there's additionally those precursors that would transform at one point or another into some of these terminal compounds. So there's changes that happen, and there's different mixtures that may occur depending on the life stage and depending on the type of exposure that's occurring. And this can make comparison a little bit difficult. So we look at drinking water, and then we look at what's in the body of people who are drinking from that water, and you might see a slightly different composition, purely because some PFAS can essentially build up in the body more than others. So in this example, PFHXX, which is that PFAS on the previous slide that had a very long half-life of 8.5 years, is accounting for a much larger proportion of what's in the serum because it's accumulating. So we have to take that into consideration when we're looking at some of the other factors, such as duration and frequency. But then at the end of the day, the end goal in many of these cases is to create these exposure models where you can take the information that you have collected from measurements and the information you've collected from questionnaires or observations and understanding what is happening when an exposure is occurring. You can create a model and then predict what somebody else might be exposed to. So ATSCR has put out this PFAS blood estimation tool that's available. I encourage everybody to go and check it out. It's a pretty cool model. And it's really based on drinking water. So if you live in an area that has higher concentrations in your drinking water, you can go and input that information and see what your serum concentration would be just from the drinking water. So this is really a general population model. For occupational populations, occupational exposures, we take the data and create what's called a job exposure matrix, which is very similar, but it's categorized based on job criteria and not so much drinking water and recreational activities. And then we create this model and we can hopefully apply that to others. And we're in the process of creating some of these. There's a lot of people working on these types of models and providing data to put into them so we can understand the potential for exposure based on different factors. But the data, so in terms of monitoring and methods for PFAS, I do want to spend a few minutes talking about how we actually measure it, because it is not as simple as it maybe sounds. So when we talk about measuring PFAS, there's one of the first things that always comes up are what are the analytical capabilities. So factors such as the limit of detection or how low can you go is really critical, particularly when you're comparing across different matrices or different points in time. And comparing from different labs, you really want to understand what the lowest detectable level is for that lab. Similarly, are you taking a targeted or a non-targeted approach or something in between? What are you measuring? Are you able to measure a select set of PFAS, such as measuring PFOA or PFOS, or even better, the branched and linear forms of PFOA and PFOS? Or do we not have methods to analyze the specific PFAS we're interested in? And we need to take a total fluorine approach and figure out what is the actual quantity of potentially PFAS that's present. There are pros and cons to both. Typically, as you go down the triangle that you can see on your screen, we're looking more at a screening method. So as we get into total fluorine, we're trying to see, is there anything present? Is there potentially more present than what we're picking up with our targeted methods? And at the top of that triangle, those are the methods that you typically will see when we're looking at anything that's related to compliance and regulatory action, anything that's related to the epidemiology around PFAS and understanding the specific health effects of a certain exposure. But we have targeted lists for a very small fraction of PFAS. And so we really only have the capabilities for the chemicals where we have standards or where somebody has characterized what that chemical looks like on the instrumentation that we use. There's also some challenges around the transformation from precursors to those terminal compounds. And then there's also considerations for whether the ingredients or the PFAS that were there are added ingredients or if they're contaminants. Do we know to look for them? We can't measure them if we don't know that they're there or if we don't have an indication that we need to try to measure for them. So that can affect how we set up our methods and what we are going to be testing for. The time between the exposure and the test, again, can be really critical depending on whether you're looking at serum or the environment and what kinds of transformations you're able to capture. And then considerations for the comparison population and background exposure, understanding again how low you need to go, or are there potentially other factors that need to come into play when you're trying to account for somebody's exposure, and then the pathway and the route. So to provide an example from the published literature on occupational PFAS exposure, for the most part, this is a literature review study, looked at the body of literature that had been published as of 2021. So it's now a little bit outdated already. But most of this work had really focused on fluorochemical production, but there were quite a few studies of first responders and then followed by office workers. Interestingly, office workers are typically used as a reference population and not necessarily a population that was anticipated to be exposed. But these studies really focused on blood samples, as I kind of mentioned before. This is a great matrix for looking at exposure, and we have methods that are well understood, and we have comparison populations. And then they looked at the long chain PFAS, so those PFOA, PFOS, NA, and so on. This is largely because these are the ones that have been used historically, but also they stick around the body for a long time. So blood's a good matrix for that. And then they use what's called an LCMS method, which is really great. It's a typical method that's used for these terminal compounds. GCMS might be used for some of the more volatile compounds. And so you'll see that pop up when we look at air and we look at things that are more precursors. But simply saying that we analyzed PFOA or PFOS, looked at long chain, doesn't necessarily mean that all the methods are comparable across the board. So I want to provide an example just to show a little more of the complexity of how when we measure air, urine, and serum, depending on the panel that you have access to, you may not have the exact same thing measured in each of these. So there's a little bit of extrapolation that happens. End of the day, we make it work. But there's a lot of evolution that's happening with methods, a lot of development, and ultimately a lot of really great work that's going into improving methods for PFAS right now. Preventing cross-contamination during collection and analysis is a topic that has become really critical for environmental sampling and analysis. It's also something we look at in laboratory settings too. So I'm going to just mention it here because it is something that you may hear when we're talking about methods for PFAS. Given that PFAS has been included in so many different materials, and a lot of laboratory instrumentation includes things like Teflon linings or Teflon in various parts of the instrumentation, or it's in food wrappers and things like that that we come in contact to on a regular basis. There's been a lot of work to try to understand where we need to eliminate those materials so we don't actually get little bits of it into the sample and potentially contaminate samples. So I'm not going to focus on this, but this is something that if it's any sort of assurance, it is something that people are really focusing on in laboratory settings during the collection and the analysis and making sure that we aren't accidentally introducing samples and what we are measuring in there is truly just from the source of the sample and not from cross-contamination. But then there's a lot of analytical challenges that we still run into. These can be very expensive, limited availability. I mentioned the time and transformation. And then statistically, looking at comparisons across matrices can be difficult. Analyses of mixtures, I'm not even going to touch on, but it is definitely one that's come up a lot more. And then the background exposure and geographic variability. So I'm going to spend just a couple of minutes to put some of this in the context, or putting it in context for firefighters and exposure data. Because it's a little bit bleak when we talk about the complexities, but ultimately there's a lot of really great work going into really understanding what is going on and how can we piece these together and what does exposure look like. So when we look at different populations, different occupational populations, as well as non-occupational populations, and I will point out that the scale on the bottom of this figure is a logarithmic scale, so it is not linear, just to point that out. And firefighters are in red, fluorochemical production workers are in purple, and then the blue are various non-occupational populations, including some that have very high point sources of pollution. We can see that there's some variability within the population. And so most of the work is really going into understanding where does this variability come from and how can we identify what's happening in those populations where there's higher exposure so we can then work to reduce it. So within the firefighter literature, we've seen that certain populations have higher exposures to certain PFAS, but it's not all across the board. So for example, PFOS, PFHXS are two of the compounds that we generally see higher concentrations in firefighters, less so PFOA. So what do we do with this? We can figure out what products are PFOS, PFHXS used in, and then in those populations where maybe there is some elevated PFOA, what are they doing differently? Similarly, with other populations, we're wanting to look at local as well as national. So when you're comparing it to a national representative sample, such as NHANES, you lose some of the potential nuances to how that population lives locally, potential local sources of contamination, and so on. So this is a study that looked at firefighters and office workers in a certain location compared to the national and then compared to another population nearby, so including the firefighters. So, and you can see that there's definitely some variability, the Fox population being higher than some of the others. That's a firefighter population. There's also been work to understand differences within firefighter subgroups. So we essentially measure in different populations and then group them separately by similar traits or similar activities, such as the type of fire department they're a part of, whether they're suburban or urban, and then try to understand what's going on. There's also some great work understanding fire response activities. So there's a study based on first response workers from the World Trade Center 9/11 attack that looked at how much dust, just qualitatively dust and smoke exposure, categorized people, and then looked at differences in their concentrations and saw that the more dust and the more smoke, you have higher concentrations. And then lastly, as methods improve, we're able to really refine some of these analyses to a greater extent. So looking at not just PFOS or PFOA, but is it branched or linear? And this can give us, again, an indication of where it's coming from. So I am going to end a few minutes early, my little contribution to getting us back on track, with just a note about serum thresholds and guidance and where this ultimately goes, because it's really important to not forget that this is ultimately, all these exposure assessments are being done in the context of reducing the hazard and improving health. So there's National Academies of Science, Engineering, and Medicine, where NASM did publish some guidance a little while ago for clinicians specifically that provides thresholds for when we do additional screening and when we're trying to do additional exposure assessment, assessment and reduction strategies. So firefighters will often fall, from what I've seen in the literature, into the middle or the upper category. So these are definitely thresholds that you would want to speak with your physician about and talk to your care team to continue to evaluate. So here's my contact information. If anyone wants to reach out, I am available. I'm sorry I can't be there in the room to have discussions, but I will be around at the end of the next few speakers to be part of that panel. So with that, I will wrap up. Thank you.